Dr. Natalie Mariam Salas is an associate professor in the Division of Infectious Diseases, Department of Internal Medicine. She is a committed University of New Mexico Lobo, having completed her internal medicine residency and her infectious disease fellowship at the University of New Mexico. Dr. Salas is passionate about education as reflected in her role as program director of the Infectious Disease Fellowship. She has developed numerous curricula, not only for the Division of Infectious Disease, but across the School of Medicine, all dedicated to fostering a love for patient-centered care and stamping out infections. She has invested in her own personal educational development and is a medical education scholar and an ACGME Equity Matters Fellow. In her clinical practice, both as an inpatient consultant and an HIV primary care provider, has fostered a deep awareness of the impact of social determinants of health and patient outcomes. For this reason, she has focused her educational and academic pursuits on improving health equity for the vulnerable and minoritized populations of New Mexico. In her current role as Assistant Dean of Graduate Medical Education, she has collaborated with program directors across the School of Medicine and developing equity-focused curricula for healthcare education. With that, Dr. Salas, go ahead and take it away.
Right. Note to self, like that bio has got to be made shorter. I'm sure nobody wanted that much information about me. I'm really happy to be here today. Thank you so much for joining. And my hope today is that this can be very interactive and that we can have it more like a discussion and maybe, if appropriate, some problem solving sessions, but definitely like less of, me waxing and waning poetic, because nobody needs to listen to me talk for an hour. So I encourage you to participate either in the chat. You can unmute, use the raise your hand feature. But then also I have some slides built in. I use Slido. And so there'll be opportunities to sort of type in responses and contribute to word clouds. And I just encourage you to do so. With all of the things, you can answer more than once. I'm going to go ahead and share my slides. Can everybody see my slides and are they in the right view? Okay, so we are going to talk today about holistic review and graduate medical education programs. And the objectives are, my hope is by the end of this workshop, you will gain an understanding of the principles and benefits of holistic review and residency programs, and develop a system for evaluating ARIS applications through inclusive criteria, and that we can discuss some effective tools and processes for recruiting a diverse physician cohort. So our patient populations face incredible barriers to health equity. Sometimes it's barriers to access, generational trauma, and then we have a lived historical burden, right? Like even if patients didn't experience things directly in the history of New Mexico, we have a lot of things that the healthcare system participated in. This is a picture of one of the boarding schools that was here in New Mexico. Things that have contributed to a lot of mistrust of patients with the healthcare system. To address this, we need physicians who can give excellent medical care while also garnering patient trust through empathy and compassion. And I think I'm preaching to the choir. I think everyone here recognizes that the most effective medication in the world doesn't work if a patient doesn't take it, doesn't work if a patient doesn't trust the physician who's saying that it is effective and will help them. And so it's not enough to just know medicine. It's not enough just to know how to practice medicine. It has to be paired with the ability to build relationships with patients. And that's really what diverse recruitment is about. It's this idea of, are we bringing people into healthcare that can meet the health needs of our patients? Like, do they have the clinical knowledge and the acumen that we're looking for, but then also, do they have the lived experience that gives them the tools that are necessary to be able to connect with our patients and help them overcome all of those barriers? So you should be able to use the QR code. And because holistic recruitment is not a new topic, I always like to start with sort of like, what are the things that you are facing with now? Because the idea of holistic recruitment is great, and the implementation of it can be really challenging, but the challenges can really vary based on the program and the types of people that you're trying to recruit, the size of the program, and the resources that are available. So if you could just take a moment to consider this question, like, what's the hardest part of implementing holistic recruitment in your program? And then your responses, but you can still use the QR code over here, will appear on the screen. Based on your responses will kind of help me guide the conversation a little bit and how I want to approach this topic. And don't worry, I understand that it takes a minute to type, so. This is a common one. I think that we are, I think as physicians, right, remaining unbiased when looking at applicants. I think as physicians, we are taught to really focus on pattern recognition. And so our eyes are going to be drawn to certain things and are going to mark certain things as red flags, even if we are trying to be intentional about not being biased. Yeah, this one is another one. I think that holistic recruitment looks very different from when there are, I have a slide about this, 500 applicants for 2 positions, and then when there are 10 or 20 applicants. Like how can you really focus on holistic recruitment if you're looking at a really small pool? And then over here, this is the other thing, right? If you only have a very small group of people that are reviewing the applications, yeah, this is a classic one. Yes. Yeah, and then I like this whole thing about looking at applicants for ARIS because it can be really challenging. These are really important. Yeah, if you have a small group of people who are reviewing and people have different preferences, how do you get people aligned? Yes, so many applicants to go through in so little time. All of these really resonate with me. So when I try to think about holistic recruitment, I think it's important to remember that it begins with N. It begins with what your mission, vision, and values are. And this is maybe going to speak to a little bit of that question of how do we get everybody on the same page? How do we make sure that the group of people that are reviewing applicants are aligned? So I really love this statement, and I first heard it from Dr. Sunny Nakai, who said the opposite of inclusion is incomplete. So when you're thinking of what holistic recruitment or what like a diverse class would look like, sometimes it's helpful to ask yourself, like, who's missing from your program? And then also asking yourself, who's are the people in your program, are they representing your patient population? And who's not being represented in your class? That can sometimes help to align people in terms of what you are looking for and what is strong versus not strong when looking through applications. It is really important that programs be clear on their mission, their vision, and their values. And I'm going to harp on this a couple of times because so often the idea of a diverse classroom gets lost on this idea that a diverse class means that people don't look the same, and that's really not the definition. It's one definition for diversity, right? Okay, I always call that like the photo op moment. Yeah, you want the picture to show people that all look different, but if you look at when diversity improves outcomes, which is the whole reason why we do holistic recruitment. We do holistic recruitment because all of the data, all of the business data shows that when you have a diverse team, your product is better. But when is the product better? Well, the product is better when people are bringing diverse thoughts and diverse lived experience to the table and an environment that allows those diverse thoughts and lived experiences to sort of flourish and give space for them to all have precedence. So the first thing that you need to do is be thinking like, what are the values and goals that you're trying to obtain? Because then you can have a sense of like who needs to be at the table. So I like to ask programs, like think like what matters to our program? Are we trying to address healthcare disparities? Are we looking for language equity? Are we looking for excellence in research? What is it that matters to our program? And then where do we want to go? Where are we right now? And where do we want to go? And how will we know that we've made it to our final destination? Doesn't really exist in education, right? There's no final destination. It's just staying on the journey. And then finally, what or who do we need to get there? So it changes the conversation around diversity when you're thinking about values, when you're thinking about what the mission of the program is, and then looking at applicants to see whether or not they contribute to what that mission is. So when identifying values, some questions that you can ask are like, what are your clinical and your research priorities? What personal characteristics do best in your program? So this one's important. I'll give you an example. In my fellowship program, people who are self-driven do really, really well. We're very good at like providing people with materials. And then if you're the sort of person that can take materials and run with it, then you're going to do great in our program. If you want a lot of hand holding, you're going to struggle in our program because we really value independence and we value people, who are self-driven. And so I like to be explicit about that up front. I like to look for those characteristics. I think it's important to ask yourself when you're looking at applications like, yes, this person has a really fantastic academic pedigree, but am I looking for are they demonstrating in the application the characteristics that I know is important for people to be successful and do well in my program? This one is obvious. What skills are necessary to support your patient population, right? This is where I think language comes in. People have mixed feelings about giving credence to people who speak other languages. To me, I think it's really important. We know for sure that language equity is a huge barrier to health equity. And so that when you have, like, if you don't have language equity, it's really hard for there to be health equity. So if people can speak the language of my patients, I think that is like a really important skill that I'm going to put a lot of value on. Like we said before, are your patients reflected in your program? When patients work with your trainees, are they going to see people that they view as self, or are they going to see people that they view as other? And then what are your long-term goals as a division or a department? So again, if you are trying to build a really strong nationally recognized research program, the things that you're going to pay attention to in application are going to be really different from being like, we are going to create healthcare delivery models for marginalized patients across New Mexico. So this brings me to another audience response question, which is, what are some values that you've identified in your program? Like, what are the things that you've sort of decided to hone in on or focus on in your program? And this is a word cloud, so you can put in as many words or statements as you like and answer as many times as you like. I will also put in the things that we value in our program. we can see some things that are coming out, right? Like teamwork. Leadership, knowledge, eagerness to learn and grow, desire to serve the underserved, right? So this shows me, like when I see this, that the at least our group over here, you've spent a lot of time really thinking through what are the things that are important for your team to work. And I see some things that are popping up here, like teamwork, team player, teamwork flexibility. This is another one that I particularly appreciate, right? Some people do well in very rigid, structured programs, and some people need a lot of flexibility. And so it's important when you're thinking about that, like, okay, here are the things, here are the values that our program really emphasizes on. And then I'm going to put a plug in over here because sometimes I think that this gets missed. But that is, once you've determined your values, make sure that you spread the word, because it's not enough for you to have an internal mission. A lot of diverse recruitment, right, starts before the application cycle. And so you want people that are applying to your program to know what your values are so that they can also pick programs that match their values. So I think it's really important for you to examine your externally facing materials and make sure that the who, what, and why are really clear to whoever is looking at your website or your brochures or advertisements that you have for your program. I think that it's important to highlight resources, efforts, and successes. Like, when people are looking for programs, they want to know that if they're coming to an area and they have particular needs, that that program can support those needs. And that it's really important, I think, to remember that a program can't fulfill a resident's, like, all of their needs. And so it's important to show that you have community partners, that you have partnerships both maybe within and without your institution. And then really critical is that you have to be authentic. Just like we can always tell when trainees are not being authentic, they can tell when we're not being authentic. So be honest and clear about who you are and what you're looking for, and make sure that it's easy to access that for trainees. So now let's go on to the 200 applications to be reviewed by 2 people. How do you do it in a way that is inclusive and in a way that is holistic? You're going to see some words at the bottom here where I talk about values and experience, but I want to really highlight on this one over here, which is screening in. I think that the basis of a lot of medical sort of applications and going through medical applications has been to, like, weed out. And one of the things that I think holistic review gives us an opportunity to do is have people rise to the top. Look for the things that you're looking for and pull those out, as opposed to using arbitrary cutoffs to throw out applications. So the ACGME mandates that every GME program should have some process for holistic recruitment, and the baseline is that the recruitment process should be values-based, should include unconscious bias training. I have some thoughts about that. If we have time at the end, maybe we can talk about unconscious bias training. And then a holistic application review. And there is some resources available to determine what exactly that is, but there's also a lot of freedom to interpret that. To further reduce bias, there's some other strategies that you can consider. One is structured or semi-structured interview questions, making sure that every applicant is asked the same questions and that your questions are aligned with your values and your mission. Holistic review of the total process. So many people have a rubric or a score for the application, but what about the interview process afterwards? Or what is your final total score, your rank listing? Some of the strongest mechanisms for reducing bias are for there to not only be like a holistic scoring system for applications, but also an unbiased or holistic scoring system for interviews and for the rank list. That way your rank list isn't about less about feelings and more about, like, well, who scored the highest? They're clearly going to be number one. And then, like I said, an objective ranking style. That's what I was describing. So some general principles for holistic review in GME is identify gaps in the diversity of your program. Again, who's missing, who's not at the table, who do we need to be at the table to reach our goal? Then identifying the values, which we talked about, creating this objective rubric score. And then this one is super important, which is review and modify. Every year, our program looks at the outcomes of our holistic recruitment, then looks at the things that we focused on in questions, the things that we focused on in the application to see, are we really focusing on the right things? And is there an opportunity to modify? Things in our program that have changed from year to year include like how much emphasis we put on research, how much emphasis we put on board scores, and what we do with that information when we identify it. This, I think, is really important because it can be counterintuitive, but it's an important legal distinction. And so just remember that no rubric can include scoring systems that give extra points to anyone based on race or gender. That would violate the Equal Opportunities, the Equal Opportunities Act. And so even though we want the outcome of our sort of systems to produce a more diverse pool, that can't be by singling out and being like, well, you get extra points because you belong to a particular group of people. Other things that you can do that don't fall under this category are paying attention to things like what's the distance traveled for this applicant? How hard did they have to work to get to where they are now? And how much overcoming of adversity did they demonstrate? Do they have an interest or contributions to DI and health equity? Again, are you seeing your values mirrored in the person's application? And then how does this applicant advance health equity? Those are where I think about things like, do they have language skills? Do they have special training in things like trauma-informed care that are going to help our patient population, that meet the needs of our patient population? I want to pause for a moment, and I'm even going to stop sharing because I think that that part can be confusing, and not confusing necessarily, but counterintuitive. Any questions about this part of like the rubrics and the scoring systems?
Question about that. Sometimes, like I serve on panels for other underrepresented programs that are focused on like medical schools and bringing in people from disadvantaged backgrounds. And so sometimes, you know, when we talk about them, we do look at like, are they first generation college students? Are they people who had English learners as a second language? We look at all these these different variables. Are they from real communities? And we do include that into a point system to make sure that we're looking at that and we're getting the right applicants that we're looking for specific programs.
So that's fine. Everything that you stated is not like they're a woman, they get extra points. They're Latinx, they get extra points. That is different. Do you see the distinction? Like they have an experience that we think will meet a need for our patient is totally fine. Because the thing of the like what you're looking at is like if someone overcomes adversity or if someone seeks to better themselves or to better like their fit for a particular job through training. Those are things that you can appreciate and say our program is specifically looking for those skills. What you can't do is give points for things that people have no control over, right? Like one could argue that you have some control over your gender now, but I think you understand what I mean. Like yeah, you can't differentiate because it would be considered like discrimination, right? Like saying that if you belong to a particular class of people based on race, ethnicity, or gender, that somehow you would get extra points for that. That would be discrimination. Does that make sense?
Yes. Thank you.
No worries. And then I'm going to throw a wrench in all that and be like, I've never gotten clear guidance on exactly how to view Native Americans. Native Americans are not, so being Native American is a federal designation. So it falls differently than race and ethnicity. And there are certain circumstances where you can consider if someone is Native American, but because I'm not really clear on where that comes, I know like for certain IHS programs, because there's some federal laws that allow them to like focus on Native populations. Because that's not clear to me, I'm not going to give you advice on that, but just to say that talk to your legal department about how that might work for your patient populations.
Dr. Salas?
Yeah.
Can you give a little guidance on, at some point, I don't know if this is the right time for this question, but one of the things that I always struggled with was how to make sure that our rubrics weren't disenfranchising IMGs compared to domestic applicants, because I think that that's a really challenging pool to evaluate given the numbers of applications we face. And I think that oftentimes IMGs have less access to the mentorship and experiences as many domestic schools do. So that's always a pool that I struggled with. I feel like we disenfranchised further, although in my program, we always tried our best. It just didn't feel like we were evaluating them the same way. And I think that large academic universities tend to not evaluate them on an even playing field. And I would say, particularly in a state like New Mexico, we have lots of immigrants as our patient population. We're not living up to those values that we purport to reflect patient population.
Thank you so much for bringing this up. And I'm just going to say, like, as an international medical graduate, like, thank you for mentioning that. I'm also going to give you some statistics that I think are like so I dug into this a little bit more because I noticed that there were certain groups of people that we seem to really struggle to recruit. And like, I found out that at least at the University of New Mexico, like 60% of Black applicants are actually international medical graduates. So if you have something in your rubric that ranks people who are international medical graduates lower than people who are trained in the United States, like, you're going to lose. And actually, I'm an example of that, right? Like, I'm a Black woman. I am an international medical graduate. My family moved to Dubai when I was 11, and that's where I went to medical school. You are going to inadvertently end up removing, and not so 60% of Black applicants, 20% of Native American applicants, Native American, Alaskan Native applicants were international medical graduates. So it is really something to think about where we look at things in our rubric that may be accidentally weeding out categories of people that we never meant to. I have some thoughts about how to sort of address that. And I think the most important thing, though, because I want to go through some other slides, but I want to come back to this, is being intentional. So one of the things that we looked a little bit in terms of, if somebody was an international medical graduate, like you said, what are some opportunities they may not have? And so one of them that we pay attention to is actually work experience. So this can be in both directions, but many international medical graduates, that's not possible, nor is it like there's many reasons why they wouldn't work during school or prior to school. That is different from US graduates and things that, like, work experience is typically part of their journey by the time they're applying for residencies. And so we've paid attention to things like work experience, like research, things where we saw that giving extra points in those categories might disenfranchise groups of people like international medical graduates. And we didn't change them, but we thought about what are things that international medical graduates could bring to the table that US graduates wouldn't have, that would counterbalance those. So many international medical graduates speak another language. So we made sure to add points to things like speaking another language, or really trying to pay attention to distance traveled, because you've literally traveled a lot of distance if you were getting into residency in the United States, having been an international medical graduate, and paying attention to things like distance traveled and overcoming adversity, and trying to give points, to give value to things that international graduates may have more than US graduates, to counter some of the things that may have less of, if by not sitting in the United States. Does that make sense? I feel like I'm not being super articulate, but I hope that the concept is coming across.
It does, thank you. It's hard to articulate because I think it's just it's very hard to assign points and values.
It is
in a way that's equitable.
Yeah, and every year, right? Like that's why every year we go through the rubric again, and we're like, well, did this really land us? Like, did our rubric pull out what we were really looking for?
And on
So,
the point of Native Americans, since that's also a really important
sorry.
and actually um, decent population in New Mexico, can they be assigned, many, I mean, these are their own sovereign nations. And so in some ways they are coming from another nation. Is
Mhm.
that some way that we can assign them, if they
Oh,
do have that distinction, that we can
that
assign
is
them that lived experience of coming from, like the
coming
same
from
way we
another, like a
would,
distance traveled. Yeah,
right?
that's a really interesting concept. I have never considered that before. I would love to run this by some people that are smarter than me and get back to you. That I will say that seems very intuitive to me. But there's many things about holistic recruitment where like the intuitive thing is not the answer. And so,
Yeah.
so
Well,
I,
you you referenced legal counsel, and I think that's one important element of context. You're speaking to mostly community-based programs with very small teams, and
Mhm.
most of us don't have legal counsel available. And if we do, it's probably someone through an HR lens rather than an
Mhm.
academic lens. So if I don't know if UNM could be a resource for us when we have academic issues, or you have other bodies who would consider lending counsel to small independent programs, but that's something to consider, perhaps.
Yeah, it's something to consider. And I actually have a point about sponsoring institutions and ways that sponsoring institutions can support programs because I recognize this. I will say, though, that an HR lens is the lens that you want to use because yes, you are educators in this context, but you are hiring people. And that's the reason why these equal opportunity laws like apply because they are employment law. So it is appropriate to consult legal from an HR lens through employment law because this falls under employment law. Does that make sense?
For sure.
That is what that was a big distinction, right? Because like everybody was like, oh, what is the Supreme Court like rulings? How does that change how we look at applicants? I'm like, it doesn't, because we've always had to use employment law, which is different from what schools use for school admissions. So moving on with this idea of like creating a rubric. So you want to create this rubric that focuses on your skills, on your values, and the priorities of your program. But that sounds great until you go through all those ERIS applications, which shockingly are not built based on your rubric. And it can be really challenging to tease out all of these things that you are saying that you value and that you're looking for. So I've come up with a couple of surrogates, and these are things that have worked for my program, but I'm really interested to see if other people, maybe you could put in the chat if there are other things that your program has used to try to delineate these things. But if I'm looking for somebody that's self-directed, I try to pay attention to things like leadership roles or have they participated in committees. For overcoming adversity, I pay a lot of attention to things like work experience, to their personal statements. And then I actually pay attention to test taking experience because there's just like nothing more. There are very few things more devastating than failing a test when you're in medical training. And how people respond to that tells me a lot about their ability to like persevere and continue to push forward, especially furthering like their medical training. So I pay a lot of attention to like how they talk about their test taking experience and what their test taking experience looks like. Interpersonal skills and empathy. I look for evidence of community service. I look for teaching. Teaching takes a lot of patience, as we all know. And so when people are really interested in teaching or have good reviews of their teaching in their medical school applications, it tells me that they probably have good interpersonal skills. I also pay attention to this in their letters of recommendation. And then research. So we're not a research heavy program. And so we've spent a lot of time figuring out like what do we value in research? And I think this is really important because people look at publications and sometimes you see a bunch of oral presentations or a bunch of case reports. And so I ask every program, like, what are you looking for in research? Are you trying to determine that they can complete a project? Are you looking for the quality? Like, does their research demonstrate that they understand a question, how to find the answer to the question? Are you looking for volume, which can be important? How many different things can a trainee get done in a limited period of time when they're under a lot of pressure? But figure out what you value in research, and then you can weight it sort of appropriately. And then finally, like, even though this should be number one, but humility and insight. So I pay a lot of attention. This is where I pay attention to comments on the MSPE. So, I mean, reading through MSPs are just so painful. And for me, because I'm a fellowship program director, I'm like, they got their residency. Why do I care? But when I'm specifically looking for things like humility and insight, I read through their MSPE comments. How did they do on their rotations? What did people say? If they struggled in an area, were they able to demonstrate that they could take feedback, that they grew from it? And I find that that can be helpful in delineating some of these characteristics. I'm going to go back to test scores again, because I think this is important. I think sometimes people have this takeaway that looking at board scores is somehow wrong. And I vehemently disagree. I think that it is important to look at board scores. I just think you have to determine what the scores mean to your program so you know how to weight them. So some people look at board scores and they want to have a sense of like what that person's medical knowledge is. Some people are looking for persistence. Like I said, nothing harder than overcoming like failing a test. Are they able to come back, get in the saddle, and then do really, really well the next time? Some people are looking for hard work. This is something that my division chief told me. He's like, studying for a test and scoring hard on a test for most people requires a lot of diligence and hard work. If people do really well in tests, then it tells me that they're willing to sit down and work hard. Now, I would say that there's some psychology things that would say that that's definitely not 100% true. There are good test takers and there are not good test takers. But it is something to consider where you're like, is that a marker for how hard somebody's willing to work to achieve a particular goal? And then like for me as an infectious diseases provider, test taking, like 90% of test taking is pattern recognition. And so sometimes it's helpful for me to think, okay, well, this is how much I see they might be quite good at pattern recognition, and I can use that skill as to translate into how they're going to work in infectious diseases, or knowing that that isn't something that I need to maybe push them on as much when they're training. So these are just some of the ways in which you can use board scores to gather information about your applicant. What I would say is look at these, figure out which one is the most important to you, and then weight appropriately. So for me, I only pay attention if somebody has failed more than once at one time. And I don't use that as like a ranking, like as something that would like remove them from our program. But it does tell me that they may need support either in pattern recognition, or they may need support in clinical knowledge. And so I'm like, okay, this is like eyes wide open. This is an area where this person might need support. And then I ask myself, does our program have the resources to provide that support? If somebody looks like they're going to need support in an area, the next question I ask myself is, do we have the resources to help them in that area? If we don't, then that becomes a red flag, not the action in itself, but the concern that we don't have the resources to support what that person needs. If we do have the resources, then it's just eyes wide open and moving forward. So you've got 500 applicants for 2 spots. What do you do? Well, the first thing I recommend is that you check, you set, and you consider. You want to get help. And I think that this is an area where sponsoring institutions can be helpful. And we're working with your leadership to make sure that there can be protected time, or at the very least rewards. I started hosting a post-recruitment dinner for faculty that would help me going through applications and recruitment, because it's so much work. But it's not something that one program director can do effectively. And I would just say that rule out like one person is going to do it all, and rule in what are other opportunities that are available, and recognize that for different parts of applications, some things are very objective, things like where someone trained or their board scores, or like whether they're rule, and it doesn't need an MD to go through and look at that. So maybe you can use your interprofessional team to support you, not just faculty. This is something that I consider to be helpful. This is like my only weeding out tool that I use, which is checking applications for completeness. I feel like it is super important that for something that's as important as residency, that you check and double check and make sure your application is complete. If someone doesn't have a complete application, that is a red flag for me. And so I will sometimes use that as a tool for weeding out. I also pay attention to things, and this is sort of when I say cutoff, I mean an experience. I mean like looking at circumstances that your program may have difficulty supporting. Like, are you going to struggle to support somebody who's maybe been a clinician somewhere else but has been out of practice for 3 or 4 years? So, or are you going to be like, I really need somebody who has had this particular experience. And if they haven't had this particular experience, I don't have the opportunity to train them in it. I don't have the resources to train them in it. So I'm going to use that as something that I'm going to, as a separation device. And then consider this approach, which is the green flag, red flag, which instead of just looking at like red flags, look at assign green flags to applications that have a lot of like the baseline things that you're looking for so that they can float to the top. And then you can review those first, as opposed to like that like red flag approach where you look at things that you know that your program might struggle to support and you like review those last. So this is my last audience participation question, and this is, what aspects of holistic recruitment have been the most successful for your program so far? Because like I want to learn here as well. And I will just say, even though I like these polls, given that our group is fairly small, you are, if you would prefer typing, please type, but also if you just want to unmute and chat, that's totally fine too. So these are great standardized questions. I agree. That has been something that has been really helpful for our program. Has anybody here ever struggled with figuring out like the right questions to ask? Like figuring out good questions? Because I will tell you, this year we really wanted to like hone in on some specific traits that we were looking for, and I started using ChatGPT to help me come up with like good interview questions, and it was super helpful. So I'm just saying, like, these are the areas in which AI can be useful. Is if you are looking for like different ways to ask things, and you want to make sure that you're hitting on specific points. Like, it was very helpful for us. The last part of my talk over here is just talking about sponsoring institutions and how a sponsoring institution can support holistic recruitment. And I would say like the main things are data and resources. I think that it's really important that like our GME office, and I recognize this is very different, but that the consortium is actually the sponsoring institution for a lot of these programs. But it can be helpful, and every sponsoring institution should be able to get data from ARS about like who applies to the program, who's interviewed, like who's ranked and who matches. We look at that data every year and we provide it back to programs so programs can see like how are they doing in the categories that are important to them. Is it an issue of them not choosing people that they that maybe in hindsight they would have chosen, or is it an issue with people, they're getting the people that apply but those people aren't choosing them, or is it that like the people that they're looking for aren't applying to the program? It's really hard to determine where to intervene if you don't have data. So I think this is an area where sponsoring institutions can really help programs. Just checking over here for the chat. Oh yes.
Can you talk about which stages you review your data and what what factors that you're following, and then do you correlate it with things like practice location, or like how far out are you reviewing that data to make sure that you're finding what you want to and adjusting it?
So for small programs, the data is it's really challenging. For a big institution, it can be quite helpful. So there's a lot of different things that we can look at and different things that we do look at. We paid attention to categories of people that were underrepresented in medicine because we wanted to see who's applying to our program, how many of them are being selected for interviews, are they coming to their interviews, are they being ranked, and then are they matching with us? So we looked at that data longitudinally over a couple of years to determine whether in certain categories that we felt were important, like people who can speak Spanish, like quite frankly, like our like Native American like applicants. Is it a matter of us not choosing them or them not choosing us? We've now paid a lot of attention to international medical graduates to see how much of our populations in different types of categories, like MDs versus DOs. You can look at what parts of the country. Like one of the things that we were concerned about was that there was something in rubrics that was maybe disadvantaging like certain applicants, like applicants who were Black. And so we were like, okay, well, like, let's look at like, where are people applying from? We found that like the Southeast, like the lowest amount of applicants that from our program are from the Southeast part of the country. And so we're like, okay, so what we need to do is like advertise more in that part of the country. That's one of the things that we need to do. And then we also found the thing about like, 60% of the applicants to UNM being international medical graduates, and thinking like, wow, are people using that in a rubric and deprioritizing those applicants? And is that skewing like our numbers across the institution? So those are some of the ways that we are using that information. And I would say a lot of it just has to do with looking at the outcomes and then asking questions and then looking for associations. Does that answer your question?
It does. And then I think the other thing was kind of the scope of when should we, like, ideally we want to also impact for the state and for our regions as being very geographically focused residency programs. And so do you track graduates and correlate that back to things like where they come from? Or like a lot of us are rural programs, so rural practice means a lot. And ideally, as you know, as the university of the state, we want to make sure that a certain amount of our grads are staying here and practicing. So do you correlate that back with some of these variables? Because I think one of the hardest things to do is predict where people are going to practice and what type of medicine within the breadth of family medicine. So looking for those candidates who are more, of rural background is the strongest predictor of rural practice, and staying in New Mexico is probably highly correlated with coming from New Mexico. So we want to balance hybrid vigor with actually producing what our state needs.
Yeah, absolutely. So actually, I would say that is really challenging to get through ERAS. And that there's a lot of assumptions about like why people stay in New Mexico. And when I tried to find the data, there was no direct data about practice. There's some data around training and around where people go to train, but there's no New Mexico specific data. And so this year, the GME office implemented an exit survey that actually looks at that specifically. So we have our first set of data looking at how many of our applicants are staying, how many are leaving, are they leaving for further training, are they leaving for opportunities? And we actually asked why. And so what I'm hoping is that in the next 2 or 3 years, we will have some robust patterns that we can say, here are the predictors for people staying in the state. And we also asked the practice type. Namely, we were looking at, are they working with marginalized populations? But then we asked them if they're going to do academic work, are they doing private practice work? And so you can't get that information through ERAS, but you can gather that information. And that's another sort of example of a sponsoring institution. I wouldn't expect individual programs to do that, but as a sponsoring institution, our GME office tries to gather that data and then takes it back to programs. And we are combing through the qualitative data. I'm really asking people like why they're leaving, why they're staying. And when we have some sort of like hard data of like what we got from the qualitative data, I think we'll have opportunities to present it. We have 1 year of data, and you really need at least 3, I think, to be able to come up with some good trends. But I'm hoping that in a couple of years we'll be able to answer that question more effectively than some sort of associations and some kind of assumptions that I think a lot of people make.
I think it's important that we recognize, I think there's like 5 SIs that are active in the state right now in terms of sponsoring these statewide programs. And so I think there should be some collaboration between all the SIs or at the state level to pool this data, because I think we might find some differences from the community programs that could inform it as well. And I think we'd love to pick your brain about what data that we could ask programs to track and feedback to the SIs, and then I'll make sure that the SIs are actually communicating it to everyone else, because I think it is tough when we have these small community-based programs that, you know, data crunching is not necessarily the strength, and the SIs may or may not be paying attention to the right variables. So I think it would be great to pick your brain at another time to see if we're all paying attention to the same things, so that we can inform some statewide either legislation or policy, or just improvement in recruitment, for sure.
That is exactly, those are the things that I'm really, really interested in, because I think that there are opportunities for us to look at the state to better support recruitment and retention of physicians. And I love the idea of like all of us sponsoring institutions kind of getting together and look at addressing some of these questions. And, you know, we are happy to share resources. That's something I would love to chat with you about in the future. I want to be respectful of people's time, and I recognize that we only have a few more minutes. So I just want to talk about sort of the role, like you're saying, of SIs and how they can support things. Like, how are programs performing in areas of interest? What are opportunities for improvement? To set institutional goals, right? Like I think that the SI can help being like, here's a target focus based on some data that we've reviewed that helps the programs also focus on not just what their program goals are, but what are the goals, like you said, of the sponsoring institution in the state, and then provide data with how you're doing nationally. I think that's really helpful. And so that those are the roles that our GME office tries to provide for our programs. And I think is something that to take back to your sponsoring institution is things that are helpful. One of the things I'm going to put a shout out here is like consider participation in regional and national conferences. So I know that ARIS applications are opening soon. If you like, feel free to take a screenshot of our Diversity Nights flyer, and I'm happy to send it if you want to send it to applicants. It'll give people an opportunity to kind of know about diversity sort of diversity initiatives that people can be exposed to in the state. And then really thinking about local, regional, and national opportunities, like how do we get the message out that this is a great place to practice? It's collaborating through different, through both like our local institutions, but also thinking regionally, like, can we collaborate with things like LMSA and SMA? Can we be at these institutions, at these sort of conferences, making sure that the word is out about the programs and what specific things that we have to offer. I'm going to stop sharing here. I have only a few more slides beyond that, but again, I recognize that people's time is valuable. So I'm happy, I would prefer to just share my slides with you because I think the discussion is robust. And just kind of give us another minute or two to see if anybody had any additional questions that they wanted to ask. Or tools.
I really appreciate the information. It just actually confirms a lot of what we've already been doing, and makes me feel more comfortable with the process that we've gone through to be as holistic as possible. And based on what we've seen so far, we've only started our first class this year, but we got the kind of resident based on our process that we went through. So we felt really good about that.
Congratulations. That's amazing. That's awesome. That's what you want, right? You want to make sure that like your process, the outcome, right, is what you were looking for with your process.
Dr. Salas, do you guys conduct a separate survey of folks that didn't match in your program, of the people that you interviewed? Do you send out a survey to them asking what factors led them to choose other programs?
No, we've sort of toyed with that back and forth. There's only been one time that I reached out to a couple of applicants to discuss things, and a lot of it just has to do with like poor survey response rates and the fact that like it's really hard to like gather information about it, and also sort of like when the right timing is. So I've thought about it before, but I've never done it. Has anyone here ever done that?
We used to, and it was helpful. A lot of times we ran into things that we couldn't control, like employment for spouses or partners, and just kind of, I think, affirmed some of our suspicions. But every once in a while, we got some good actionable things back from it. And the second question I had is the rise of signaling and how you incorporate that. If you have 30 seconds.
30 seconds. I do have 30 seconds because I actually am not the right person to ask about that. I am a fellowship program director, and so they don't do signaling for fellowship program directors for fellowships now, just for it's for residencies and in these different categories. Our fellowship, they can put in like a geographical preference. And we do take that into consideration. Like the thing that we, in our rubric, you will always get the highest points on interview questions and the highest points on your application if you talk about New Mexico. Like we want people that want to be in New Mexico. If you have ties to New Mexico, if you've got family in New Mexico, if you are interested in the populations that New Mexico serves, like that's the thing that's going to take you to the top of the list. And so we pay attention to people like, yeah, I want to be in the, in the Mountain West region. I'm like, great. Like we will pay attention to that. Signaling, I've heard mixed things about it. I think a lot of people, overall, the response from program directors has been positive, but I'm not really clear how people use it. Something I'd be happy to bring back another time, though, and bring additional information.
It seemed like a tough dichotomy because some people signaled us who are very strongly fit our bill, and then some seem to use signal as a desperation attempt. And it just seemed challenging to navigate whether we afforded any extra points or a tiebreak situation or something like that.
Yeah, I even for geographic like preferences for my program, I feel like I pay attention to it more in the interview process. But we don't actually we notice it, but we don't ascribe points to it. And I think it makes me look to see if it correlates with the things that we objectively know are important, like an interest in the population, but not. Yeah, it's challenging, and also like the way it is, it's really hard to be transparent with it. Like you can signal a lot of places. There's an aspect of residency application that is just flat out not transparent and makes it really hard sometimes to objectively find people who are a good fit. Like there's a lot of noise that you have to weed through. But I think taking the time each year to figure out what each data point is going to mean to your program is really critical. And now I am 3 minutes over. I really tried to be on time. So no more talking from me. Thank you so much for coming here and letting me talk.
Yeah, Dr. Salas, thank you so much. This was a really great presentation, workshop that you presented, and great conversations were had. So thank you to everybody. We'll wrap it up here. If there are no other questions, Mario did put in the chat just a post workshop feedback survey. And then if you do want to sign up for the e-blast and any communications with the NMPCTC, the link is there. Yeah, but thank you so much. I appreciate it. Have a good day, everybody.